Hi, I'm Dr. Peter Cass. I'm an optometrist practicing in Beaumont, Texas, and I'm going to tell you a little bit about the AmbioDisk and how I use it in my own practice. It's actually a very easy product to use. It's very beneficial for lots of different corneal problems such as neurotrophic ulcers, corneal ulcers, burns, abrasions, and even severe dry eye. Here you can see the packaging for the AmbioDisk. They're really small and they don't take up a lot of space. One of the benefits of the dry amniotic tissue is that it does not have to be refrigerated, so you can actually keep it in an exam room ready to go. You don't have to worry about taking it out of a freezer. The disc is available in three different sizes: a 9mm, a 12mm, and a 15mm. The 9 and 12 millimeter are more commonly used in optometry offices just because they can easily be put on a stock contact lens. Here we're putting a drop of tetracaine in the eye to prepare the surface of the eye. I usually put this in before opening the product to give the drops time to take effect. Here you can see us opening the AmbioDisk packaging, and you'll see several items in the package. There are barcodes that you can attach to your chart, a donor card that you'll need to send in, and then of course the tissue itself. You can see we'll open the outer package, which seals and protects it, and then you can see that inside the outer package there's an inner package that has the disc itself in there. We'll open up that inner package, and you want to be careful opening this so as not to dislodge the AmbioDisk itself. When you open it, you want to observe the orientation of the markings on the AmbioDisk. You're looking for an IOP marking on the disc to show you its orientation. Here you can see we're inserting the speculum. A lot of practitioners can be intimidated by this, but the trick really is to have the patient look down when you insert the speculum under the upper lid and have the patient look up when you insert the speculum under the lower lid. So here we're drying the cornea and preparing it to receive the AmbioDisk. This is a very important step. You really want to get the surface of the cornea dry. If the surface of the cornea is wet, the AmbioDisk will not adhere to the surface of the cornea well, and you may have a problem with the disc sliding off. So here we're picking up the AmbioDisk with non-toothed forceps, and be careful not to damage the disc. You also want to take note of the orientation. You should see an IOP on the disc, and you want to make sure that that IOP is oriented towards the cornea. Here we are placing the AmbioDisk on the eye. You want to try to center the AmbioDisk over the corneal defect that you're dealing with. You can see that if the eye has been dried well, it's going to adhere fairly well. You can then take a dry Weck-Cel and smooth it out in a radial fashion, trying to work out all the wrinkles. It's hard to get rid of all the wrinkles, and you'll usually have a few. That's not a big deal. Next, you'll want to take the contact lens out of the vial and place the contact lens on the eye. You can use a Weck-Cel or the forceps, and you'll want to drape the contact lens over the AmbioDisk and center it. Once the lens is in place, you can remove the lid speculum gently and have the patient blink and wipe away any excess tearing. At this point, honestly, the drier the better, so that that disc will adhere to the surface of the eye. You'll want to take a look at the lens with a microscope. You can see some minor folds here. Those are not a big issue. Patients should be very comfortable with the AmbioDisk in their eye at this point. I see healing very quickly. The disc will last 5 days or so, but you should see significant improvement and significant patient comfort with this product. For an alternative procedure where we don't use the speculum and actually place the AmbioDisk on a contact lens and then insert the contact lens, check out our other video.